Hi, I'm Jessica Roop, Manager of International Policy at the American National Standards Institute, ANSI. This is a short introduction to provide a brief overview of the Standards Alliance Initiative and the Standards Alliance Project on good regulatory practices and regulatory convergence for the medical technology sector. ANSI is a 501c3 not-for-profit organization comprised of public and private sector entities to serve as the voice of the U.S. standards and conformity assessment systems. ANSI is pleased to have been designated by the U.S. Agency for International Development, USAID, as the administrator of the Standards Alliance Initiative. The Standards Alliance is a USAID funding facility designed to provide capacity building assistance to developing countries, specifically related to implementation of the World Trade Organization, WTO, Technical Barriers to Trade Agreement, TBT. The main objectives of the program have included increasing understanding of the WTO TBT principles, implementing the Code of Good Practice for the preparation, adoption, and application of standards, improving transparency in the development and/or modification of technical regulations, and achieving more robust and transparent engagement with private sector in standards development and use. ANSI works with multiple organizations to implement specific projects to advance the Standards Alliance goals with particular sectors and geographic regions. The Standards Alliance Project on Good Regulatory Practices and Regulatory Convergence for the Medical Technology Sector is a USAID-approved project implemented by the Advanced Medical Technology Association, AVIDMed, working in conjunction with public and private sector partners in the United States and across Latin America. The goal of this project have been to assist designated Latin American governments maximize regulatory efficacy and efficiency through the provision of public and private sector expertise and resources to support international, regional, sub-regional, and national governmental initiatives to adopt good regulatory practices, also known as GRP, regulatory coherence, regulatory reform, and good regulatory management. This project has emphasized the adoption of internationally recognized best practices, as well as the implementation and reinforcement of policies promoting the use of internationally harmonized voluntary consensus standards and conformity assessment mechanisms. The countries in scope to receive capacity building assistance with this project have included Colombia, Mexico, Peru, and the CAFTA-DR countries of Costa Rica, El Salvador, Guatemala, Honduras, Nicaragua, and the Dominican Republic. Particular focus has been placed on cooperation with Colombia and Mexico as multiplier organizations within the region, working in partnership with Brazil, which is active in the areas of both GRP and medical technology regulatory convergence initiatives, including within the International Medical Device Regulators Forum, the IMDRF. This project has been structured within two tiers. Tier 1 focuses on the identification of international benchmarks for good regulatory practices as governments are applying them as fundamental policies on how they should regulate for all sectors. This work was concentrated primarily with the agencies of Central Regulatory Review, executive offices of the presidencies, trade-related ministries, and interagency committees that are responsible for improving administrative efficiency, improving regulatory efficacy and stakeholder participation, minimizing technical barriers to trade, and maximizing international regulatory convergence for all sectors. Tier 2 focused on the identification of the international benchmarks for good regulatory practices as governments are applying them for the medical technology sector. This work was concentrated primarily with the medical device regulators agencies and ministries of health, but also with the national standards bodies, national standards committees, and the private sector stakeholders active in the development, adoption, and use of international standards and conformity assessment mechanisms. Each project tier has 4 phases. Phase 1 was the identification of the applicable international benchmarks. Phase 2 was a gap analysis of the requirements in Colombia, Costa Rica, Mexico, Peru, and the United States. Phase 3 initiated bilateral work to begin filling these gaps. And Phase 4 initiated multilateral work to begin filling these gaps. We've developed 2 series of webinar videos in which we review the findings of each tier. A common theme for both Tier 1 and Tier 2 is that standards and conformity assessment policies that prioritize the use of international standards are themselves a good regulatory practice. When such policies are codified, requiring regulators to seek and use applicable international standards as a basis for regulation, the governments are able to most cost-effectively meet the requirements of regulatory impact assessment to conduct public consultation with the broadest base of stakeholders, to economize limited agency and public health resources by leveraging international work, to minimize the creation of technical barriers to trade, and to apply the state-of-the-art standards to patient care within their jurisdictions. Although the particular project to conduct this initial assessment is now complete, it is our intention to leverage these seminal reports and cooperative channels created to serve as a foundation upon which the respective governments can focus their efforts to more comprehensively implement GRP and regulatory convergence for the medical technology sector. The project partners continue their support toward the goals of the USAID Standards Alliance project. We look forward to and remain available to working with governments in the region to provide ongoing resources toward the end of realizing the project objectives. Thank you.